So good afternoon, everyone. Welcome to our virtual seminar on policing and police reform in the United States. I'm Jennifer Brick-Murtazashvili, the director of the Center for Governance and Markets here at the University of Pittsburgh, and I'm really delighted to introduce to you April Fernandes, who will be speaking today. She's an assistant professor of sociology at North Carolina State University. Her work explores the consequences that result from low-level criminal justice contact. In particular, she focuses on how employment health and housing are compromised after an arrest, misdemeanor conviction, or jail stay. Prior to her position at NCSU, she was a postdoctoral fellow at the University of Washington, working on a multi-state project centered on monetary sanctions assessed after criminal convictions. Both of these research agendas focus on the detrimental repercussions of criminal justice contact with an eye towards the impact on inequality and stratification. Our discussant today, as always, is Brandon Davis, who is an assistant professor of public policy. He's assistant professor at the School of Public Affairs and Public Administration at the University of Kansas. His research focuses on American politics, public policy, race and ethnicity, and law and society. So we're going to run the seminar today. April will give her presentation. If you have clarifying questions, you can go ahead and ask them in the Q&A. And then leave your more substantial questions to the end of our discussion today. So without further ado, April, take it away.
Excellent. Well, thank you all. Let me share my screen very quickly. Can you all see that?
Yes.
Perfect.
Thank you. All right. Thank you all for the gracious invitation to present this work in progress, exploring the physical and mental health effects of police contact on Black women. And also thank you for allowing me some space to not repeatedly check exit polling. All right. So as we all know, the high profile use of force incidences and police killings of Black men often take center stage due to the disproportionate contact between Black men, boys, and law enforcement. The existing scholarship suggests that there are myriad negative health effects as a result of police stops, frisks, arrests, and use of force for Black men and Black boys. Activists and scholars, however, have pointed to the relative invisibility of Black women and their experiences of police contact. The stories of Dejira Becton and Breonna Taylor and Rekia Boyd are well known. However, it is the names of Black women and girls, such as Tanisha Anderson, Angel Rosenthal, Breon King, that are seldom uttered, seldom heard, seldom lifted up in the aftermath of their violent and sometimes fatal interactions with law enforcement. The work of the Say Her Name campaign is about centering the experiences of these high-profile incidences, but it is also about the mothers, sisters, daughters, girlfriends, partners, cousins, aunts, and grandmothers who have been stopped, frisked, arrested, surveilled, threatened, maimed, and killed at the hands of police. While the number of incidences do not rise to the level for Black men, these points of contact can be consequential and often differ in kind as well as in their consequences. Furthermore, the role of Black women within their communities means that the potential impact of any point of contact can be detrimental to outcomes for health, well-being, as well as legal cynicism. The relative dearth of research of Black women's experiences with police informs this work, with the central research question centering on Black women and their physical and mental health from both direct and indirect contact with law enforcement. As with Black men, Black women are more likely to experience use of force in interactions with law enforcement, thereby leading to direct physical injury. However, emerging research suggested that indirect vicarious contact can also be influential. In the next few slides, I will discuss the relevant literature that helps to examine the connection between gender, race, health, and contact with police. If my computer works. So first we start with the disproportionate police contact that Black people and communities experience, especially under what Fagan terms new policing. This era of new policing is characterized by increasing surveillance within Black communities and other communities of color, resulting in the expansion of stop and frisk tactics, vehicle stops, and aggressive and invasive police procedures that increase the use of force and the potential for fatal police outcomes. Research has ably demonstrated that the increase of negative and increasingly invasive and violent interactions with police heighten legal cynicism and distrust of law enforcement and other social control institutions, largely based on perceptions of discrimination that seem to emanate and inform these interactions and the implicit profiling of individuals and communities of color. Existing research on the relationship between discrimination and health has found that both perceived and actual racism and discrimination results in negative health outcomes to the physical and mental health effects of the stress and strain of anticipatory or experienced racism. Scholars who study everyday discrimination, ranging from microaggressions and the denial of services to degradation and humiliation and harassment and threats of violence on the basis of racial identity, show an increasingly prevalent effect on health outcomes, with some researchers suggesting that police contact should be regarded as an institutional form of everyday racism and discrimination that can render similar negative effects on health and well-being. Indeed, research has linked police contact to negative outcomes, suggesting that the relationship between health and contact with law enforcement should be understood as a public health issue, compounding existing racial disparities in terms of physical and mental health. Scholars have found that health impacts can be seen through direct contact with law enforcement, often resulting in injury due to the use of force during the interaction, as well as the increased stress and depressive symptoms during and after the incident. Due to the disproportionate police presence, surveillance, and contact that Black individuals and communities experience, such direct contacts are rarely isolated incidences, but rather exist within a pervasive atmosphere of police presence, surveillance, and pedestrian and vehicle stops. Such pervasiveness can really lead to indirect or vicarious points of contact, which research has found can also contribute to negative health outcomes for those living in communities characterized by constant and aggressive police presence. For those communities that have experienced a police killing, for instance, existing research from Gomez and Bohr and colleagues suggests that individuals within the adjacent neighborhoods experience higher levels of stress and negative mental health outcomes. Research from Sewell and Jefferson found negative physical health effects resulting from neighborhoods with higher rates of pedestrian stops, suggesting that all forms of contact can detrimentally influence health outcomes. Shifting the focus to gender, there is a limited research on women's experiences of police contact, and even fewer studies exploring how Black women's interactions with police diverge. What we do know, however, is that women and girls do have contact with law enforcement that differs in type and in kind from males, with research and media accounts detailing physical and sexual contact being mainstays of interactions with law enforcement, as well as the threat and use of physical and sexual violence, especially in interactions with Black women and girls. Research has recently focused on the ways in which the physical and mental health of Black women and girls can be differentially affected by all points of contact, ranging from police stops and arrests to court adjudications and incarceration, finding overwhelmingly negative effects due to the increased use of violence in these interactions, as well as the trauma resulting from the use of invasive contact and unwanted sexual contact in the commission of a stop or arrest. In addition, research has detailed the indirect effects of contact, showing that Black women can exhibit negative physical and mental health effects as a result of indirect contact with law enforcement and the criminal justice and carceral systems. For instance, Lee and Wildeman found that Black women who have an incarcerated male family member have higher levels of heart disease and hypertension due to the stress and strain that the disruption of incarceration wrought on the individual, as well as the family unit and the broader community. In exploring the aftermath of Freddie Gray's death in Baltimore, Yim Gang and colleagues found that mothers in the city experienced elevated depression levels that sustained for months following the police killing and the civil unrest that followed. These findings highlight the centering of Black women in the ongoing discussion of police interactions as imperative to understanding the scope and full consequences of this era of new policing. So in order to investigate the relationship between police interactions with Black women and its effects on physical and mental health, I used the Black Families dataset, which is composed of respondents who identify as Black or African American. The study was conducted by Drs. Elon Hope and Keanu Cryer-Coupé at North Carolina State University. They distributed a Qualtrics survey in 2018 to a random sample, garnering responses from about 1,000 young adults and 604 of their caregivers. In exploring the data, I noticed that the vast majority of caregivers surveyed were women, which provided a unique opportunity to explore their interactions with law enforcement, as well as the outcomes that are tied to contact. The total N is 508 women with a median age of 42, an average education level being some college, and 70% were employed at the time of the survey. And on average, they had about 2.5 children. These next few slides give us a sense of the descriptive nature of the data all right, there we go. Description data with with fairly good physical health measured on a scale from 1 to 5. They also have similar levels of depression and anxiety with stress levels that are relatively elevated on a 4-point scale. We can also see that 96% of the female respondents have health insurance, and which is relatively kind of unique in terms of the vast amount of people who have actual health insurance. And then when we look at contact, we can see in direct contrast to the popular narrative, 70% of women in this sample report at least one stop, while about a quarter report at least one arrest. Again, while most of the focus is on the interactions between Black men and boys due to their elevated frequency of contact, these numbers suggest that the experiences of Black women are also salient to the conversation about police and Black people in communities. And so in terms of the methods, various outcome variables were used to assess this relationship. For physical health, I used a self-report measure that asked for a general health assessment. This was measured on a Likert scale from 1 to 5. The mental health measure is comprised of 21 measures that assessed various aspects of depression, anxiety, and stress. The resulting scale variables were used separately in the models to isolate the impact of contact on each mental health outcome. And if you have more questions about the mental health measures in particular, I have the separated out measures to give you a better sense of the kind of complexity of those particular questions. I employed 2 measures of direct contact, self-reported police stops and arrests. One of the limitations of the data is not knowing the timing nor nature of the police stop, which can inhibit any inference. However, existing research has shown that even routine traffic stops can heighten perceptions of discrimination and levels of stress and anxiety among people of color. Therefore, the nature of the stop may be less consequential than just being stopped at all. The direct contact measure is an aggregate variable of 14 measures. It captures the levels of surveillance and contact within the respondents' home communities based on their responses. As stated previously, research has suggested that there can be detrimental impacts on health based on the vicarious experiences of police contact and violence within neighborhoods and communities. Therefore, assessing the indirect effect may be important in grasping the full extent and weight of police contact on Black women. Additional controls include age, relationship and employment status, educational attainment, income, health insurance, region. And in addition, I include an aggregate variable for everyday discrimination, which is comprised of 8 measures that assess everything from individual level to institutional racism and discrimination. There's also a measure of police trust that assesses how the respondent perceives the efficacy and effectiveness of law enforcement. If you'd like to see those detailed measures, I also have those in extra slides. Also for the indirect contact models, I control for direct police contact in those models in particular. And so for the results.
Wait, before we go to your results, sorry,
yes.
There's a question, Dave.
Oh, I'm sorry.
No worries, that's my job.
For some reason.
Dave, we don't want you watching the chat box. Dave, do you have a question?
Yeah, I was just curious for the arrest and stop data, if that was reported for ever having an arrest and stop. Was it for the last 3 years, last year? Just
yes. So the time frame, sorry, I should have mentioned that. The time frame was the last 3 years. They're asked to think back at the last 3 years. So it gives us some sense of timing, but not necessarily like a precise time point, which would have been amazing. So sadly, I know, I do wish, in doing survey research, I was like, oh, that would have been so great if you did kind of like a more fine grained, like, when was this? But yeah, that's a good question. Thank you for that clarification. Any other questions? All right, great. All right, so for the results, I've just constructed simple graphs to discuss the main outcome variables and their statistically significant findings. If you're interested in the full tables, I have them available, and they're also available in the distributed paper starting on page 23. So the first table shows the results for direct and indirect contact and physical health, showing that an arrest has the only significant and negative effect on physical health. Due to the existing research and the media accounts of police contact between law enforcement and Black women, this suggests the use of force or other aggressive physical contact may be a factor in this impact. The null findings for police stop may be indicative of the high rate of health insurance that this sample reports. Many studies report that Black communities often suffer from a lack of access to appropriate medical care, often due to the lack of affordable medical insurance options. However, in this sample, 96% of female respondents report having health insurance, either through an employer or publicly funded insurance. Therefore, this result could be indicative of their higher income levels, as well as the higher rates of unemployment and better access to care than other Black population samples. And an interesting note are the results for one of the controls, which is everyday discrimination. And this shows a consistent negative and significant effect across all models, regardless of the outcome variable. And this suggests that racism and discrimination that Black women face daily has an impact on their physical health, even when controlling for other factors. And while we find the same result across all models, it really highlights the salience of everyday discrimination in conversations and research about police contact. And so for the direct contact and mental health measures, we see an increase in depression. Oh, sorry. I went too far. There we go. Okay. So for the, sorry, this is, all right. Then switching to mental health and direct contact, we see that across all models, only anxiety shows a significant effect, but in the opposite direction as expected. In this model, anxiety is decreased as a result of a police stop, which seems to be counterintuitive to the existing literature. However, this finding may be the result of the range of experiences of a police stop. As mentioned previously, the data does not offer any indicators for the nature of the stop, so it's possible that these reports of stops may not produce the same mental health effects that we expect. It is also possible that the anxiety measure may not be capturing the actual impact of a police stop and arrest, and that more fine-grained measures are needed. It's also possible that because it's an aggregate measure, that something's getting lost in terms of the aggregation, and that maybe the component parts of this aggregate measure are more appropriate for this level of analysis. For indirect contact and mental health, we see an increase in depression and anxiety and stress as the level of indirect contact increases in respondents' neighborhoods. So this is in line with existing research, which shows the salience of indirect contact in neighborhoods that are beset by increasingly high levels of police presence, surveillance, stops, and arrests. These results suggest that for Black women, the conditions within their neighborhoods and the treatment of their family members, friends, and neighbors weighs heavily, prompting increased levels of depression, anxiety, and stress. In the second set of models that you'll see here with the lighter blue, we see that when we control for police trust among the respondents, the negative and significant effects of depression and anxiety disappear, but the negative impact on stress remains. While more investigation is needed, these results suggest that police trust can be an important factor that can influence how Black women interpret and perceive interactions with law enforcement. If trust is high, it may be that depressive effects or levels of anxiety may not be elevated due to the assumption that police are efficacious or that they are treating all citizens fairly. However, such ameliorative effects cannot be seen on stress levels, pointing to the importance of analyzing multiple forms of mental health in order to capture such nuanced effects. This result for stress points back to the robust literature on the impact of discrimination and everyday racism on the stress levels of Black Americans, showing that interactions can increase stress responses, and that even the anticipation of racism and discrimination can prompt higher stress levels. This is a work in progress. So the next steps for the project include adding in a measure of Black women's perceptions of their points of contact with police. This may be an important part of the puzzle in terms of teasing out both physical and mental health effects, and then really getting at how women perceive the nature of that particular point of contact. In addition, we're going to look at how the interactions of the respondents' children play on Black women's health outcomes. As we saw in terms of the descriptives, the children of these women were also surveyed, and we have some of the same measures of both direct and indirect contact, as well as physical and mental health measures. So it would be interesting to look at then how contact for their teenage children, because they're ranging in age between 14 and 17 at the time of the survey, how that then interacts with the health of these Black mothers. Early models show that the arrest of a child actually leads to a decrease in the self-assessment of physical health and increases levels of depression and anxiety for Black mothers. And so I think that will be an interesting piece to kind of add on to this existing research. This may be a really important part of the story, especially as it pertains to the research on the vicarious experiences of Black contact. And finally, adding in legal cynicism measures will capture the global perceptions of police and court efficacy that may explain some of the variations we see in the results. And other measures that are included in the survey include coping mechanisms, especially when confronting points of everyday and institutional racism. And so that's another part of the story that I think is an important piece to see how these kind of buffering effects could impact then health outcomes. And there are myriad implications from this type of work, but mainly it highlights the importance and necessity of centering work on Black women and girls. Their experiences are salient to the broader discussions about police use of force and brutality in and among Black communities. But in addition, existing research has shown that their interactions differ from their male counterparts or from white women, emphasizing the need for more scholarship to better understand the nature of these interactions with law enforcement, as well as their nuanced and complex consequences. In addition, it underscores the importance of exploring various forms of contact, both direct and indirect. While most empirical work is looking at direct contact, especially for Black men, the indirect points of contact are indeed influential and can have a more widespread effect on central and surrounding communities. And in order to truly understand the impact and costs of aggressive and pervasive police contact, we need to investigate the complexity of these experiences, not allowing any interaction or population to remain invisible. Because with this invisibility, police reform has often left Black women and girls out of the conversation, and therefore solutions to the entrenched problems surrounding police and Black individuals and communities have not taken into account the harm, danger, and threats to Black women and girls that are complex in both the nature of the interactions as well as the consequences that result. Therefore, it is imperative to say their names, in order to enact meaningful change in the interactions between police, Black individuals, and communities. Oh, thank you.
Thank you, Professor Fernandes. That was fantastic, really interesting, and a lot to think about. Brandon, I don't know if you want to react, have any comments?
Yeah, I just have thank you for the presentation. I was wondering, like, I guess with the indirect measure, these network effects that you're capturing, I always think about like social disorganization theory or economic deprivation theory, talking about how these non-traditional beliefs get filtered into these communities with a lot of incarceration. And so I want to know are there questions to ask if they know someone that's have contact? Do they personally know someone in their family, or is it specifically this kind of like political socialization process where or maybe some through direct observation, but political socialization process where that the word on the street is the police are like this. So when questioned, I tell people the police are like this, and and it could be like that kind of I guess like socialization process or in that sense, and also. Black women are twofold affected, right? So you have them themselves being targets of police, but they are also affected by being attached to those men that are in jail, those men that are in and out of prison, right? So they're the ones, like academic deprivation theory, they're the ones making up the putting bread on the table, having to make up lost income. They're the ones having to drive to jails. They're the ones having to put money on people's books for commissary, stuff like that. So it's like a 2-for-1. Terrible sale when it comes to Black women and police context. If you have any thoughts about that, I'd appreciate it.
Yeah, no, and I think the twofold, like exactly what you're talking about, the twofold nature is exactly at the heart of why I think this question is so interesting. And I think why often, it's interesting to me, given that they are hit from really both sides in terms of having the disproportionate direct contact, but also having then the weight of all of these men who are either currently incarcerated, have been incarcerated, or who are in danger of future incarceration, right? And having all of that really become part of their process. And I think it would be, I really do wish there was more kind of contextual information in terms of the survey to get a sense of, how many people are in your life, or do you have a other family member besides your child who has been incarcerated previously, to give us a sense of, is it about this sense of I have this, seemingly it's like different levels of vicariousness. And so on one level, it's about, I have, exactly the situation you're talking about. I have a male partner who is incarcerated. So therefore, I'm putting money on the books. I don't, I'm paying to go visit him in this far-flung facility, and I'm having to wait and be degraded while waiting, you know, in the work of Megan Comfort, in terms of those understandings. And then also I'm having to make up for all of this lost income and the loss of another set of hands, another voice in the room, right? And all of these kind of attendant effects. Or is it about, right? And then there's this other point of, I hear, right, that my neighbor down the street, right, is, you know, her son got arrested, or her son got stopped and had a stop and frisk incident. I'm, you know, hearing all of these things or seeing them as a daily part of the course of going through your everyday life. And so I think I think the complexity and multiplicity of those experiences, I think, is something that actually needs to be investigated a bit more in terms of what point of vicarious contact are we actually talking about? And then how does that influence then not only your feelings about, and your, like, you know, kind of psychological distress that you're experiencing, and the psychological distress that then patterns back onto health impacts, but then also how does that impact then your belief in the system at large, and then these issues of legal cynicism and distrust. And then how does that play on kind of like cohesion and system avoidance and these kinds of factors? Yeah, so those are my like comments of so much. I mean, this is what I think, you know, I guess I didn't realize before starting on this project, like how much we just don't know about Black women and about their experiences. And it seems odd given that they're so centrally affected on all points. And so, yeah, I think that's one of the things where, and I really try, you know, in doing this work is like one step in trying to understand a bit more, but then really realizing that we need, you know, step, you know, 500, 600, and 700 on the other side.
It seems to be hard to detect what's the true cause, to decipher how much of this is caused by, you know, the contact, as opposed to like if someone has a loved one incarcerated,
right?
Where's the stress? Where's the greater source of the stress? And also, like, what is the general stress level, right? So if there's like a general Black stress level, right, and then compare generally to other people in the population, other women in the population.
No, exactly. And I mean, from the research that we know, like the existing stress level for, you know, Black women is fairly high. And then, yeah, what is the impact? And I think that that's also a limitation of the data being cross-sectional. And I could just talk about limitations all day, which is probably not super helpful. But it just because of the fact that like longitudinally, it'd be really interesting to track this understanding of, okay, so stress level at time 1 is X, and then your, you know, partner, your brother, your son is incarcerated, and then then we can measure at time 2 to actually be able to see, yeah, what are those implications? And I know that the, you know, scholarship that we know of really has some of that, especially like the Lee and Wildeman, in terms of mapping onto this understanding of, okay, how can we understand truly the impact of having an incarcerated family member, an incarcerated male partner, in terms of these impacts because of the stress and strain, but also the just increased responsibilities that they're then kind of saddled with in the absence of this other person, and having all of these kind of attendant responsibilities that come with mass incarceration.
Yes. Brian, did you want to follow up?
No, we can open it up.
Yeah, so actually, I just have a question. I think the results are really fascinating, and the anxiety, as you noted, the anxiety result is sort of puzzling.
Yeah.
And it just led me to think that, would it be possible to do some kind of qualitative research to supplement this? I mean, I know this is sort of a difficult, the population would be difficult to identify. You've got minors involved, adds a whole nother layer of complexity. But it seems like being able to do something like that would allow you to tease out these causal mechanisms.
Definitely. And that's, I mean, the work that I started out doing was quantitatively looking at the collateral consequences of what is termed kind of low-level contact, right? So an arrest, a misdemeanor conviction, jail stay. And frustratingly, I found that there were answers that I could not really understand from that. And so I then, once I, became a faculty member and got just a little more money and less time, I decided to do a qualitative project asking those same questions of people here in North Carolina about, what are these large impacts, on employment, on health, on housing, but then, these smaller things like, did you lose cell phone service, right? Did you miss an appointment that was important? Because a jail stay, on average, 48 to 72 hours. So what is, what are these kind of small and large kind of consequences? And I talked to probably a little more than half my sample were Black women who, I mean, even before the interview started, was like, are we going to talk about, me being pregnant in jail? And I was like, we will talk about whatever you want. Or can we talk about the fact that I couldn't get my medication? And all of these kind of points where that really kind of informed my understanding of the ways in which they are experiencing some of the same disparities and same kind of erasure or dismissal that we know in the literature that Black women experience when going to the doctor. But that is then compounded when they're in a correctional facility and the correctional officer is saying, you don't have a headache, or you're not bleeding enough to have a menstrual pad, right? And so, or I don't really think you're in pain. I think you can take it, right? And so therefore, that leads to this kind of impact. So I would really love, long story short, I would really love to do a qualitative piece of this work to actually then tease out some of these impacts and see that, because I think that the quantitative, while, I do, half my work is quantitative, half of it is qualitative, I do think that sometimes there are significant limitations in terms of when we're trying to understand the world through a quantitative lens, and especially when we get results that are just a little counterintuitive, a little off in terms of our understanding. And so is it about the measure? Is it about, the difference of the sample? But how can we actually get at some of those mechanisms to better understand that relationship between especially anxiety? I think something as complex as anxiety, and the way at which it manifests itself for Black women in particular may be a really important piece of this conversation as well. So yeah, I think that's a dream, yes.
Fantastic. David Scarbeck has a question. David, do you want to introduce yourself too? Yes.
Hi, I'm Dave Scarbeck. I'm a political scientist at Brown, and I just come here to lurk and listen to interesting talks. So thank you very much for your presentation and the work that you're doing. I think it's really a difficult area to work in, and it's important that there's as many people as possible trying to sort of better understand these issues. I guess I sort of had a little bit of questions or maybe suggestions in thinking about how to present the results. So as we all know, limitations in our work is it's always a challenge to overcome them, but you have so much great material here that I think that, there's really a lot to contribute. I was a little unsure how to interpret the scale or the measure for things like the anxiety index. So that's not a variable or an index that I work with. So it wasn't clear to me entirely how much 1 point or 2 points on the scale is in a sort of like a real world substantive sense. So if someone tells me they made 50% more money, I have a pretty good sense about what that means. But if someone's 50% more anxious or 20%, that's not terribly clear. So I was curious if you could maybe say a bit about the sort of substantive context of the results. So, you know, how big are these? Are they big? One way to respond to that is exactly the point that Jen makes that I agree with, which is that, you know, you can just tell that, you know, some qualitative evidence here would really do a lot to communicate the underlying mechanisms about what's going on and why this is so important. So if you are able to do that project, it sounds like you may be, I think that'd be great.
Yeah, no, and David, thank you so much for your comments. And I think you're exactly right, is that both you and Jennifer pointed out, I mean, the qualitative piece is kind of essential. And what I found, at least for doing that for the previous project, is that I had, you know, results for the quantitative piece that kind of didn't make sense, you know, or were a little bit different than the limited existing literature. And then the qualitative piece really helped to flesh out, because the women would talk or the men also would talk very explicitly about how mental health is affected, let's say, from these different points, and how it's really coming at them from all sides, because it's not only a concern, the concern for themselves and those outcomes, but also in terms of the concern for their children or their family's well-being because of those results or those points of contact. And so I think it's really important. And so, for the mental health measures, I put them up in the slides just to give a sense of the different questions that are asked for each different mental health measure. And so, and they're scaled on a severity scale from 1 to 4, asking people how often this is a kind of concern for them. But I think and these particular measures were also by another researcher were evaluated in terms of their appropriate level for Black respondents in particular, because there's a huge concern in the mental health literature that the measures that we use are not appropriate for other individuals of color, and that they are based often on a white model of understanding of mental health, which does not help us at all in terms of understanding that. And so this, and so we can see that the kind of severity in terms of stress would be that in terms of the actual results are that it's a, it's a pretty, it's a moderate increase. And so it's not so severe as that we're, overly concerned, but it is seen as kind of a more moderate increase in terms of that. But I think that that's really something important that I should emphasize in the eventual paper and all subsequent presentations, because I think that would really be helpful to kind of orient then the nature of the result, but then also understanding that within the context of the measure. I think that's really good.
Follow up with sort of another related question, which is, I guess I was a little unclear in the presentation what the comparison group was. So are the surveys only for Black women? So I guess the question is, how does this, the relevant question seems to be, how does this compare to either other ethnic gender groups or to people who have no or less contact with the police? Are they in your sample?
Yeah, so this is a sample solely of people who identify as Black. And these are the caregivers of the youth who answered the sample. So there's about 1,000 teenagers between the ages of 14 and 17 who answered the survey. And then about 604 of their caregivers, both men and women, also answer the survey. And these can be biological parents, these could be grandparents, these could be aunts, uncles, these could be adopted parents, or foster parents. And so it's a kind of range in terms of caregiver status. And so therefore there is no there's no other comparison group unless we wanted to compare to, let's say, Black men in the sample, but they're a relatively small number. The majority of caregivers who answer the survey, and it should not really be surprising, were Black women. And so therefore the comparison group it's going to be difficult to actually compare them to anyone, but this kind of sits within the kind of emergence of Black criminology and the idea that we need to kind of center the experiences of Black women, and that comparing them to white women or Latinas or to Black men or white men, for example, can be helpful. But in this particular context, doing it in a with a data set that only looks solely at Black individuals and their children, it really gives then a deeper sense, I think, of an understanding that is unique, especially because many of the samples kind of do a comparison. And there are great studies that actually compare across different racial and ethnic groups, and great qualitative studies. The Hitchens study that I cite in the paper and in the presentation is an amazing example of ways in which we understand how the experiences of Black women and white women and Latinas differ all across the board when it comes to police contact, and the ways in which race and gender really operate in very fascinating ways. So I hope that makes it a little more clear.
Yeah, I mean, I think it's a very important point.
Yeah.
But could you look at the experience and anxiety of Black women over time when police contact is more and less frequent? That would be a way to avoid the sort of intersectionality concern that you raise about measurement, but still have some comparison for how big an effect is it? How much is this coming from contact versus other factors? So I guess I'd try to tease out some sort of maybe longitudinal framing. Anyways, thank you very much. Sounds like a great project.
Yeah, no, and I agree. The longitudinal investigation, and that's most of the work that I've done. I don't love doing cross-sectional work just because a lot of those questions become unanswered that you're asking, David. And so I think that I would love the problem, and this is a problem that we see with a lot of other points of contact, so that most of the time that Black women are lumped in with, they just do a aggregate measure of Black experiences of policing when they do these surveys, or women are not oversampled. So therefore we have and because the frequency of contact for Black women, even though it is disproportionate as compared to white women or Latinas, it's going to be lower than it is for Black men. And they're often left completely out of the empirical analysis and as well as the data collection. And so I think that that's one of the problems in terms of longitudinal data and the ability to actually do that work. But we are finding more data sets that are coming, especially those that are crowdsourced, to look at police contact. And because we also have a lack of administrative data, right, that is actually routinely and systematically collected. And so that becomes another source of the issue in regards to that. So yeah, but I have another project with some folks doing a quantitative analysis of police killings, looking at the neighborhood context, but including women by race in the sample, because that had not really been done before. And we thought that that was really shocking. And so I think that, yeah, I know I take the point. I think that the longitudinal nature is incredibly important, as well as, actually taking Black women into account when collecting the data.
Great. Do we have any other questions?
I have a question. You said, so you have, and the sample total is 500 plus women, right?
Right.
All right. So 70% of them have had contact. Could there? I don't know if there's enough, but could there be a a relationship between those who have not had contact and those who have had contact? Because you have a sample and 350 of them have had contact. That means what, 150 or something have not had contact?
Right.
So having I don't know how you do that, but you could have a variable that says, you know, Black women with contact, without contact, like a you know, is that common variable, something like that?
Yeah, no, there could definitely be, and that's a really good idea. And maybe we'll look at that and see, because that would give us then a better sense, and especially of your original point about baseline, right? Of trying to get an understanding of baseline mental health measures in order to kind of see that differential and then see how that plays when we have women who experience a stop or who experience an arrest. And I do think also that some of the other measures that give us a better sense of the perception of that contact will also help to kind of make those measures, make the contact measures, especially for direct contact, a little bit better. But that's a really great idea. I will look into doing that, because
and you have gradients, so you could have a threefold, like 0 is no contact, 1 is pulled over, 2 is arrested.
Right.
So you have a gradient of contact.
Yeah, and we also have there's some measures that look at then, you know, what happened in the, you know, during the arrest, like were they handcuffed, you know, and it's a small number of women who experience being handcuffed or the use of force, or who report at least the use of force. But it would be kind of an interesting way to do that kind of gradient effect. I like that idea a lot. Thank you.
Great. Do we have any other questions? Okay. Well, I just want to thank you. This was a really fascinating presentation on such an important topic. I'm going to give you a round of applause. And you know, this is, I know this is sort of the beginning of your journey on this work, but I'm just so fascinated about what you'll be able to find as you continue on this road. But yeah, this was just a lot to think about. And you took our minds off of a lot today. So thank you again for that. And it was a real pleasure having you. And if you have any questions for Professor Fernandes, you can find her contact information on our phone number. You can also, if you haven't downloaded the paper already, you can find it on our website as well. And then the recording of this video will be available on our YouTube channel. So you can look at that later. So thank you again, Professor.
Thank you all so much. I really appreciate, especially doing a work in progress. And this really helps immensely in terms of the next steps in the project. And hopefully maybe you'll see a paper with some qualitative results eventually.
Exciting. I'm a huge mixed methods.
Yes.
Nut. So thank you. Take care.
Thank you all so much.
All right. Have a good one. Bye-bye.
Bye.